Unsafe working conditions, the rebuttal by me, Desiree Blaney for Psych 301. Before I start, I just want to thank my nurse friends that helped me with this. Unfortunately, my partner did not provide me with a video of their presentation, and so I had to come up with arguments by myself. And I asked my nurse friends and my doctor friends what would keep nurses, medical professionals working, and they provided some really good input. So thank you very much for that. And let's begin. So the argument. Medical frontline workers are being forced to work without proper PPE, which is personal protective equipment, in very understaffed hospitals. Officially, over 9,300 US health workers contracted COVID-19. Yet, those numbers are inaccurate because many hospitals are refusing to test their medical staff. Even with symptoms, medical frontline workers are still told to work or be fired. My solution that I presented in my first debate video was that they should close the hospitals if they fail to provide a plan to protect their employees from exposure to COVID-19. If they can close a hospital because the hospital refused to admit all alcoholics in Louisiana, then they can close a hospital for not providing a safe workplace for hospital staffs, because ultimately these hospitals are putting not just the hospital staff in jeopardy, but the patients that they're trying to save. If the hospitals can't close, then the United States Department of Health and Human Resources should step in and take over that hospital. Ideally, I believe that all medical frontline workers should fall under the HHS during national emergencies. The HHS has already relaxed a lot of federal regulations that allow medical frontline workers to work across state lines, and they have also provided almost $22 billion to COVID-stricken hospitals. If they can do all of that, then HHS should be able to seize hospitals that are not in compliance with safety standards. The first argument that my nurse friends posed to me is that medical frontline workers are not being forced to work. They can quit whenever they want to. And I say that that's not true. Even though, yes, the action of them quitting is a possibility, it does affect them in very drastic ways. The first thing, if a medical professional decided to quit, which has happened a lot during this COVID-19 pandemic, the hospital itself usually changes the dialogue, saying that the nurse or the doctor abandoned their patient or neglected to care for their patient or was showing insubordination. And that alone is really negative. And if these medical professionals try to find another job, like, the employers look at that. And so how could, even if they did quit, it still affects them. Second, they can't claim unemployment. And during a time where there's 22 million people in the US who are unemployed, that is horrible. They can't even get in line to apply for unemployment. They're disqualified if they quit. The second argument that they posed to me was that medical frontline workers are obligated under the Code of Ethics. Okay, sure. In regards to nurses, Provision 2 says that the nurse's primary job is to the patient. But then Provision 5 also says that nurses owe the same duty to self as to others. And realistically, if they're working on the front line and they don't have the PPE that they need, or they're understaffed and they're ridiculously tired, they're not doing anyone any good. They're actually putting their patients more at danger and a higher risk of exposure because of the conditions that they're working in. So regardless of the code of ethics, there's also provisions in there that help the medical frontline worker protect themselves. So that's what I think. Then argument 3, PPE shortages is a worldwide problem. Yes, it is. But that doesn't mean that these frontline workers should be working without it. And if in World War II, the United States mandated that all factories produce war items like guns and planes and vehicles and clothing, why hasn't our government issued a mandated order that all factories start making PPE? Instead, these healthcare workers are going out and finding their own PPE and trying to bring it into the hospital. And then the hospital is telling them that if they wear that PPE, they will get fired. And a lot of people have been fired because they wore their own PPE. And I think that's ridiculous. If there's such a PPE shortage, then there should be some kind of relaxation on protocols so that these medical professionals can at least try to protect themselves as much as possible from this disease. Because ultimately, it helps both of them. And that is what I argue. Thank you for your time.